Cool people doing cool shit. Sounds pretty cool, doesn't it?
My guest tonight is Brandon Yuenger, physical therapist, among other things. And we're here to talk about all that stuff.
Sure.
So start at the beginning, like, where did you start out and how did you end up where you ended up?
I started out as like a electrical engineering major at Grand Valley. Electricity was always interesting to me, and then I started doing the engineering stuff and was like, this is not at all interesting for me. So I moved into like biomedical science and didn't really know. I was interested in psychology and just human medicine in general. And didn't really make the choice, I guess, but I ended up in physical therapy school and it made sense for me, and it makes sense looking back now. So what brought me to now was a relationship that I had at that time. Their health was failing, and nobody could really figure them out. They're getting bounced around from doctor to doctor, and nobody can really say, here's anything that's going on. I remember the head neurologist at University of Michigan told her, people like you need to think happy thoughts, and that's what you have. So we ended up going to...
What was the reaction of the two of you when you were told to just think happy thoughts?
She was very depressed, and I was like, I had been waiting to take her to this guy who ended up being a mentor of mine for a while, because I was going through school and learning about, hey, there's these alternative things. This guy does craniosacral therapy and acupressure and like sound healing and stuff like that. And that's where Mary Freebed's outpatient neurologic rehab was sending a lot of their more complicated people that they couldn't get better. So I was like, hey, there's this other option. Why don't we try this guy? And so we went there, and what was going on with her was she would pass out and then could tell you everything that happened but couldn't move. And she could try to vocalize, but she was mainly like blinking answers. So we had accidentally one day, I was trying to help her with a headache and mobilized her neck, and she took this big deep breath, and she was in one of those states, but she took a deep breath, woke up, and could move around. And at the time she was actually in the hospital, so she walked out to the nurse's station, because when physical therapy came in earlier in the day, they're like, you need to walk with a walker, because she wasn't safe to walk around. When she would get in that state, she would be like drunk, like almost falling down. So yeah, we'd accidentally woke her up. She walked out to the nurse's station and says, look, like I'm fine now. Like, can we do something about this? And they didn't have any idea. They said, do your research, we'll do our research. And ultimately she left with no answers. But we could use that same technique repeatedly to bring her out of that state. So I was like, there's something going on.
And what was the technique that would bring her out of that?
Was just like find her third cervical vertebrae, and I would just like push it like this.
Oh, wow.
And hold it there. Huh. And then she could move again. Did
you ever figure out what was actually happening and why the third cervical vertebrae was the fix?
No, not really good answers, because at the time I was thinking of like my, the way school teaches us is it's evidence, evidence, evidence. You got to like do imaging and all that kind of stuff. So I was like, can we do that while she had an EEG lined up to measure brainwave activity. So I was like, let's do that. And like, cause you could move other parts of her neck and it would put her into that state, and then move this one and it would wake her up. And so we were like, why don't we put her into it and then wake her up and like see what the hell's happening inside of her brain. And then they also were doing, to check blood flow to the brain. So I was like, why don't we do that too? Maybe we're changing something about the vasculature, and maybe that's what's changing, getting blood flow to her brain. So nobody ever did that. We weren't allowed to do those things. So ultimately she ended up going to see this guy, and then went out where she couldn't move during the evaluation, and I did the thing to wake her up, and the guy was just doing like this and like nodding his head. I was like, all right, like he's seeing something, I guess. And then she went out again, like a few minutes later, and I said, do you want me to do the thing again? And he's like, think of this, if all the information that her body is telling me is accurate, this will wake her up, and pulls on her leg. And she wakes right up. And I was like, what the fuck is going on? And whatever, they wrapped it up, did their business, and he asked me if I had any questions. I was like, I feel like I have so many questions, but I don't even know what they are. Like, something awesome just happened right now, and I want to know more about it. And he said, learn acupressure. And so I learned acupressure, and a couple months later I started practicing, and eventually was hired onto a team at Mary Free Bed that had been trained by this person. And so I got to start practicing all of this stuff like right away.
So but for real, like why did pulling on her leg?
Why do I think? Yeah, because there's not like we're not gonna be able to say here's what that was. But I think that he was probably sensing that she wasn't grounded through that leg. Like so, because he's very perceptive to energy, and like energy for me is like a byproduct of our nervous system, because we have electricity running through our body all the time.
Right.
Which this is one of the things I was like, here's what I took from engineering school that I still will use to help people explain like how we have like an electric field. It would stand to reason everything does that has electricity in it, but we don't perceive that visually. I think that we perceive that like with our bodies and feels and vibes and stuff like that. But so
it's sort of alarming when you become aware that has always been going on, and you didn't think that was a thing, and then all of a sudden you're like, oh shit.
Yeah.
There's like literally no no coincidences.
Yeah.
Because you're always reacting against that electrical field from the other person.
Yeah, I feel like you're either fighting it or you're flowing with it.
Yeah.
Yeah. And I mean, we're often doing both.
It's magnets either this way or this way.
Yeah.
All the time.
Yeah. I started just telling people, hey, here's why you feel better, because I'm doing this weird stuff. Like I was sitting there with like acupressure books on my lap because I was a new grad, so I hadn't been practicing long at all. And like looking at the book and then touching spots and then flipping the page and then doing that stuff. And they're like, I feel better. And they would be stronger and they'd have better balance. And they're like, why? And so I would tell them electricity flows through your body, and then there's this field around you. And this is the explanation that I would use is, like I said, the leftover engineering is there's 2 points in space. They have a voltage difference, so which means they have electric current between them. And that means they have between them and extending away from those points, there is a magnetic field. And so we all have that magnetic field. Electricity is coursing through our body all the time. Like everything that you see, I mean, especially if this is what you do, everything you see, everything that you hear is altering the way electricity is moving through your body. So that thing is constantly changing based on like your environment, but also like your thoughts and all these things that change how we fire those neurons. And so I think a lot of times with people that I work with, just understanding, like you said, just understanding that that's real and part of them, and that could be an answer for whatever problem that they're seeking answers for, can be a really big deal. And the way you said it sounds like maybe you had it like it was like all of a sudden you're experiencing like this whole new world opens up.
Yeah, I think for me it was sort of all of a sudden, not all of a sudden that it was happening, all of a sudden that I recognized what was happening.
Yeah.
And I was like, oh my God.
So the world that I'm living in is like, people aren't as fast with that. There's like, they get a little bit and then they like chew on it, and they come back. And like for a lot of times people aren't, like I'm not necessarily teaching everybody. There's some people who are interested, and then we can talk about energy stuff, but there's a lot of people who aren't interested or just are unaware, and I'm not trying to push that onto anybody, but they start eventually asking questions like, why did I feel this thing, or why are these things happening? And then some of them are interested, and some of them are just like, I feel better, see you later. And then there's some, like, you sound more like somebody who would be ready to explore and be like, this is cool. Can we like do more of that?
Yeah, that's kind of my jam. Yeah. I joke with my kids all the time now. Be careful what you think about or say, because you're about to be slapped, good or bad. You're about to be slapped in the face with whatever it is that was occupying your. So like it's not even just physical, like, and that sounds like so.
You're talking about karma and just like, what's the word? Just like manifestation, whether it's good or bad.
I stop short because it's repellent to me to say law of attraction, but basically, what you put out giving out electrically maybe, or maybe psychologically. I don't know what.
This like
and maybe there's not a difference.
Yeah. I think that's just probably
all of a sudden you're just like, you're gonna get it back.
Yeah, I think in what you're experiencing is like even beyond that, because I try to make it so, like beyond what I'm usually talking to people about. But it is very interesting to see when they start to see that life it's bigger than just like their physical body or whatever they came in with, and they see that life can start to change. And that, because I'm dealing with the body a lot, how your life changes will affect how you feel and how your like physiology functions.
So you're on board with like the global stuff that I was just talking about, obviously, but you are working specifically with the physical body. So how do you see one manifesting the other, or vice versa?
I mean, it's kind of like what you're saying. There's like a reciprocity that exists. And I don't necessarily work only with the physical, but we start that way. Like people get referred to me because they have issues with balance or pain typically. And what I typically am seeing is like...
And just to, you said it'd be, but on the surface level, you're a physical therapist.
Yeah.
So entry point, that's why people are coming to you, because they have a physical issue.
Yeah.
And then...
Yeah, and then do they have that awareness, awakening that you described, or don't they? And they just end up feeling better, and when they don't do what you're talking about right now, there is an education about their nervous system and how they have their control over their own nervous system. And they just learn about fight or flight, rest and digest, and that's something that they can have control over. And what I find is that once you get good at getting into that rest and digest mode, then you can explore a little bit more about that like bigger space that we're talking about that eventually connects us to like everything, which is what I think you're talking about.
Yeah.
Yeah.
Did they ever figure out what was going on with
the girlfriend?
Yeah.
You know, when we broke up, no. And as far as I know, she's continued looking for like the next diagnosis to like tell her what's wrong. And so it's been interesting in through my practice to start to see people that are very similar in like their presentation, and then be like, oh, this is what's going on. So, and typically, generally speaking, the answer is, how does trauma affect our body? Because that's not something that our medical system is good at screening or treating. And so, and I think that's the big connection between a lot of these energetic techniques and some of the, we haven't talked about it yet, but some of the like indigenous medicine that is focused on relieving trauma and healing trauma through the spiritual route. And so that's what I think, where those two things kind of come together, is trauma dysregulates us, and then there's these ancient spiritual healing techniques that are so much older than modern medicine that have been helping clear the traumatic imprint on our nervous system. You know, we have these actual problems that we agree on, like trauma exists and it affects us and it's not good. We don't know how to treat it, but there's this other culture that exists that does know how to treat it very well. And that's where I'm at right now, is like, can we integrate it? How can we integrate it?
How can we not?
Well, I meant like, how is it possible to do it within the system that we're in? Yeah, we definitely should be, 100%.
Like, how often do you feel like once you've worked with someone for a minute, you're like, well, I'm not actually dealing with the physical malady is just the symptom that presented itself. What I'm actually dealing with is trauma that possibly, as the professional here, I'm the only one that is aware of this.
Like that
trauma.
That's what's happening
Yeah.
for this person. I kind of go into, at this point, since starting private practice, I started, like, that's what I go in with, is like, there's trauma that's affecting this person in some way, and that's the reason they're in front of me in the first place, because I'm not usually people's first stop. You know?
Okay.
And so people have tried the musculoskeletal stuff already for whatever hurts, and then they're looking for something, a different angle. So I usually just start there. We don't necessarily start with those conversations, but there are people who will have like memory flashbacks and stuff like that, or an emotional response during or afterward or whatever it might be.
Because you pushed on a particular spot?
Yeah, it's like...
And it triggers something?
Yeah, my experience has been that it's kind of like, as you start to move energy through their body and clear things, there's stuff that's kind of like stuffed down that can like make its way to the surface and then be perceived and experienced or whatever it might be. Does that make sense?
That makes painful amounts of sense.
But so there are times where you'll have somebody Ralphing you, and that will come out because they have gotten deep down into like a major part of the pattern and how you hold it in your body.
We'll probably cut this out, but I went through a painful breakup in January, and for a good number of weeks after that, I thought I had Crohn's disease. I definitely thought I had colon cancer. I'm like, oh my God, in addition to telling the kids that we split up, I now also have to tell them that their time with me is limited. Blah, blah, blah. It's really just that their dad is an emotional dude who holds all of his emotions between his diaphragm and his kneecaps. And so any number of things is going to go wrong in the interim until you work through that. And I had to go to a very, very dark place that I don't recommend for the general public. But when I came out, I had finally found the cobwebs in the corners that I had missed in years previous. And I wish that you could be okay without going there, but it seems like you can't. It seems like you don't get to skip that step.
And you're talking about utilizing psilocybin to get to those cobwebs?
I wasn't, but absolutely, because that's a whole other side of it. I wish that I had known about psilocybin 9 years ago, because 9 years ago I was dangerously depressed. I was a danger to myself. What I learned in the last 6 months with very careful microdosing of psilocybin was that I think on the first dose, but for sure by the second, all of those self-loathing and overthinking circuits got permanently snipped. Right. And it's not like you don't have rough days, but you don't think they're apocalyptic. You don't think that you're exclusively a worthless piece of shit. That all went away. And I could go on and on and on about my advocacy for psilocybin, microdosing, for that reason. But actually, that's a good segue away from psilocybin, maybe. But I also saw on your website that you also started to delve into more like the spiritual side of things. And talk to me a little bit about that.
Yeah, maybe it's a segue back to it as well.
Maybe.
Yeah. So that was kind of like a natural progression of just becoming interested in what I was seeing that wasn't explained by like our medical sciences. Like having people have these emotional responses and having people have, there was a while there, it was after a few years of practicing, where I started having like on a pretty regular basis, like multiple people a day would be having what we would describe as like a shamanic journey. Like they would go to a different place in their mind and they would move around within it. And sometimes they're like given gifts, or like animals will come out of the woods and lead them somewhere, and they'll have like these realizations about themselves and their lives and whatever else it might be. And so I was just curious about it and just kept learning. And this is like what we started talking about with like that reciprocity that life gives you. So I got to a point where, oops, I shouldn't do that. Where my mentors weren't answering my questions any longer. And I like this story because it kind of shows, it's back to like the fundamentals of how it affects a person in front of me. I wasn't getting good answers for what I was experiencing any longer. And my current partner, her mom has done training to be Reiki master and like yoga instructor, and she's done this shamanic healing training multiple times over. And she was telling me, you should do the training. And I was like, I want to stay in mainstream medical culture. That sounds like it's like a pretty big departure for me. She's like, then you should read this book about the her teacher, who I eventually did learn from, taught at a school started by a guy who spent a bunch of time in South America in the mountains and the jungles, learned those healing techniques, and then brought him here to school, all that kind of stuff. So I did read that book, and what I was experiencing was kind of what we were talking about, is like over and over again, I'm working at people, I'm sitting at their head, because I did and still do a lot of craniosacral therapy, and that was kind of like the way in to this like energetic world, spiritual world. But I started seeing there would be like dark spots in a person's body, like coming, kind of all collecting, and even from like their field around them at their heart, and then they would lift up.
You're seeing that physically, or
I'm seeing that with my eyes closed, like perceiving. I tend to sense energy primarily like visually, so I'm closing my eyes and like allowing myself to see what's going on. And that's what drives most of my treatment. Like the direction and the like rehabilitation part is more logically based, like helping somebody get to where they're going. But when I'm actually working with somebody's body, I'm letting like their energy kind of dictate, like what are we gonna do next? Or what can I do to help this person right now is probably a better way to put it. So I was seeing that over and over with this like dark stuff lifting out with my eyes closed, and it would like leave out the ceiling or above or whatever, and then in its place would come all of this light that would like fill up all the spaces where all that dark stuff was. And that's where I was like, what is it, guys? And I didn't get any really super solid answers. But then I read the book that I was given, and it described this process that they called illumination and like extraction. So it was like that extraction of the dark energies and then illumination with the light. And I was like, holy shit, that is exactly what I'm talking about. So first I read through / skimmed this book and was like, great, I'm not crazy. There is an explanation for it. And not only that, but this is something that cultures have been doing for millennia. Like it's not new. It's just new to me right now. So the second time I read it, it was one of those, I don't know if you ever have this, but there's a few books that I've read where as I can maybe read a paragraph and then it like, I have to like close my eyes and rest, and then I can read another paragraph. And so that was one of those things that I read most of that book on a trip to Colorado, and it was just punctuated like read a little bit. And I felt like I learned so much that time, so it helped me expand my practice through just reading this book. And then I wanted more answers, so then I learned all the techniques through this training that this woman was doing. And as that went, I was watching my whole practice change around me, and like the way I was utilizing the things that I was learning in a way that was palatable for people that are coming in the Western medical setting. And they weren't like some people would think it's weird, of course, just talking about meditation and things like that. Like if somebody's like, my knee's fucked up, and they aren't gonna hear that maybe there's another answer, and here's like the complexity that you are as a human being. Some people don't wanna hear that, and so they don't like that. But what I was finding is more often than not, I could incorporate what I was learning about these spiritual healing modalities and apply them within a session. It was just a matter of how and when, and that was an exercise in me of letting go, because I can't dictate how that's gonna go. It has to just organically happen. Like as you can start to develop, like acupuncture has a lot of good research. But even with that research, there's still the strong bias against it that it doesn't do anything. And I've seen people cite like opinion papers about, and see this is why it doesn't work. But then there's like actually like better designed studies that are like, here, acupuncture works for a whole host of different things. But I'm kind of like thinking sometimes, why do we do research if it doesn't matter, if your bias is still, it's like some people who are louder, like anti certain things, I think it gets easier, especially if they're in the majority, to kind of get on that train and also be like, yeah, that's bullshit, right, guys, But that's my version of once you experience it, you can't unexperience it, and you start to see that there's just more to us.
You mentioned just in passing, but you mentioned Native American practices every day. Like, I'm not kidding you. Like, the running joke in my family is I'm so exhausted by the fact that there are no coincidences ever. I'm tired of being told that. Blah, blah, blah. I've got a fucking cardinal that seems to have been following me for 3 weeks. On and on and on and on. But the more that I know, like, about different, like, if I would never pick a religion. But if I were to pick a spirituality practice, it would always hardcore run at full speed towards my understanding of how the Native American culture looks at life on this earth.
Agreed. Same.
Because literally, like, you and I, like, just even barely exist, basically. That's like, gross oversimplification that probably I'll cut out because it's so inaccurate. But
I know what you're saying.
You know what I'm saying?
Yeah. It makes sense. It makes sense. Like, especially you can, like, feel it make sense.
We have dogs, and because we have dogs and a big sugar maple in the backyard, that means we don't have any grass in our backyard. And this summer has been great because I start every day in my pajamas out in the backyard, barefoot in the dirt.
Yeah.
And as long as it takes, and then also listening to see who other than the thousands of sparrows might be in the neighborhood. That's just a really great way to start the day.
How you said until what happens? However long it takes.
I've noticed that for me personally, if I can start the day with any time in the woods, or if I don't have time for that, in the literal dirt, and that sounds like so. If I was hearing me say
like
that, I would be
crunchy.
skeptical of someone saying that. But that practice alone calms my nervous system, connects me not only with the ground, but also with now the birds that I'm hearing in the trees. And even as recently as a year ago, if you had said that that would be a thing, I'd be like, give me a break, man.
Yeah, I can see. I mean, it can sound corny, but also feel the same exact way. Like, we forget that we're part of nature, you know? There's some cultures that I suppose don't, but a lot of, like, modern Western culture doesn't really think about that we're part of nature, and that sounds like what you're doing is just remembering that.
Yeah.
And it's a good way to start the day. I feel like I'm due right now, but try to just get out and kayak or go camping or something, and it's just such a nice reset. But in the meantime, I kind of do the same thing. Like, there's trees in my yard, and I've got a garden, and it's nice to be able to, like, start with just checking everything out. Yeah. And I find that starting my day with yoga does a very similar thing, or like a run or something like that. Like, it's very grounding and centering.
I did like 45 days in a row where I woke up every day at 5:45 because stupidly I started this practice before my kids were out of school. So in order to do it and still get them to school, I had to get up at 5:45, which is nonsense for a creative person, but I had to stick with it. But that was great. It was meditation, affirmation, visualization, a little bit of reading, a little bit of journaling. I fucking suck at meditation, especially guided meditation, because now, you know, you're probably getting guided from your phone. I'm distracted by the fact that the sound is coming from. I'm horrible, and I don't know if you have any insight to give me to get better at that, because I understand the value of it. But if you want to light my ADHD brain on fire, tell me to meditate.
Sure.
So how do I?
Well, I can tell you how I address that, and it's not.
Please.
The guided meditations, I feel like when I'm never recommending them, but I'm not saying don't do them to anyone, because if they are helpful, awesome. But
I also suffer from "you're not the boss of me," so guided right off the bat is probably not a great.
Same.
But
Same. Yeah, I never did any of them, and I don't know if that's why, but yeah, I was just like, all right, when are we? When are we done with this? I start with breathing, just like the bare bones, and I'm usually teaching people about the physiology of it. But our diaphragm is hardwired. It's got multiple inputs, but the one we focus on is because if you just expand your diaphragm and let it, as you breathe in, and you want this one. Yeah, because you kind of did like beep, 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 beep.
Yeah, I didn't get it.
That's all right, but you would practice it because it takes a second. But just starting with that, you start to get feedback through your vagus nerve to your brainstem, which starts to upregulate your parasympathetic nervous system, which is your rest and digest. So there's a couple different ways. I usually like.
So sympathetic is fight or flight, and parasympathetic is everything's cool.
Yeah.
Okay.
Yeah, there's a theory out there called polyvagal theory that would say that we've got sympathetic fight or flight, and then we've got two divisions that they care about. There's a lot that are that sympathetic and parasympathetic do. Autonomic nervous system, those are the two divisions. Sympathetic, parasympathetic, and they do everything we don't think about. So there's like so much going on. And this is how you can.
It's still doing it.
That would be homework.
Yeah.
You get to practice that, and then your ADHD brain would be like, fuck this, I'm done with this. I can't do it. And that's one of the things so we're talking about what I do every single day, and I try to prepare people for that eventuality that you're like, I just say, if you can't do it, keep trying. Because, one of the things that I lean on is that as we go through multiple sessions with somebody where I turn down the volume and then they start to see that it's possible, we're also starting to make a pathway for their nervous system to get there. And so keep practicing it because that's like the most important thing, because it's going to link you back to that parasympathetic nervous system.
So what were you saying? I jumped in there, but what were you saying specifically about the diaphragm and the parasympathetic?
That it's innervated. One of its innervations is the vagal nerve, or the vagus nerve, which comes out of our brainstem, and so you're giving through your diaphragm a parasympathetic input to your central nervous system.
Oh.
And so just expanding, contracting, expanding, contracting. You can do it like really fast, and then you're going to get more of a sympathetic activity, but people will do that. If you're familiar with breath work, holotropic breathing, it's like to induce a altered state of consciousness. People will do I'm typically teaching people long, slow, let's get the vagus nerve, let's get you settled down, but you can, people will do it, the word that comes to mind is to try to invoke a state of ecstasy within themselves, or just the altered state that you can get to with psychedelics or something like that. It's just like a non-substance way to get there. You know what I mean? So that's not one thing that I'm working on with people, because they can do that. It's just not conducive necessarily to a chronic pain. Well, it could be. I'm sitting here debating with myself. I don't do it that way. I think it's more valuable to be calm it down, be able to flex that muscle of turning the volume down for yourself until you get good at it. And then you can do it whenever, and then you can grow from that place. But it's kind of if you're trying to change something about your nervous system and how it's functioning, if you are always in this slightly triggered, slightly fight or flight mode, which we all kind of are because of the culture that we live in, you're never actually going to rewrite patterns. You're just going to be fighting against yourself. So what I find is that and this is through some of the movement stuff that I'll give, that if I give a person an exercise that they need to be relaxed to be able to get the benefit from, it becomes pretty obvious because their body stays stuck in its more rigid pattern. And that's just based on where a tissue's tight. Are they out of alignment? Are they immobile in certain areas? That's the way that I would assess it. And a psychologist, I'm sure, has their own ways of assessing that. But yeah, so calm the nervous system down first. I think I got off topic because it is more complicated than just the diaphragm diaphragm does parasympathetic, and that's the end of the story, because you could use it multiple ways. So maybe a little bit too much information, but that's how you can kind of tap in a more tangible way. Because a guided meditation, you're trying to be now picture this, and now picture this. But I find that if you're in that more receptive state, more parasympathetic state, then you're more receptive to following and getting something out of that guided imagery.
Back to the spiritual part of it, how do you either find that entering into your sessions with people, or how are you integrating that? Or I don't know. I don't know if it's if you're like putting that into the session, or you're just noticing that was already there. And maybe it's a little bit of both, but
yeah. So it's impossible for me to like do a session or like be with people and not notice that they're, that energy stuff is there and happening. I mean, it's all right, because that's my,
I feel you,
that's
brother.
my job, yeah. But so that's always there, and it's always informing what I'm doing. So it comes in through that route, but it's inserted also but it's more in the form of, here's meditation strategy. So we start with the belly breathing, and then can you get to relax? And once people are getting relaxed, we've already been kind of, the relaxed at home is one thing, and the relaxed in the session is another thing.
Sure.
So it gets really easy pretty quickly when I'm doing work with somebody for them to be nice and relaxed. And so I'll say, hey, you got to keep practicing your breathing stuff until you're getting really nice and relaxed, but we're going to start adding a couple things that I want you to become familiar with as part of like a meditation, so that you can like get the most out of this or whatever it is, or have more tools at your disposal, to see what works best for you. And so my first step is for them to connect to the directions. And if you're familiar with Native American spirituality, there's the seven directions, or sometimes people talk about the 4 winds of the north, south, east, and the west. But it's always interesting to see people who don't have that background, and especially in such like a heavily conservative Christian area, where they will have experiences. Like I had somebody who just on Wednesday, who he was struggling. It was like his 3rd visit, I think, and he was like really struggling with getting his brain to focus. And then he had a bunch of like memories happen for him, and then he connected with the South as we were finishing up, and he was like, my brain was thinking, and then all of a sudden it was just, there was nothing but light, and then I lifted my arm, and my arm was this wing, and all the light just kind of came in, and he's like, I don't know. It's like, I don't know either, but that's pretty awesome. And not everything is that like magnificent, because like what a beautiful thing to have happen for him, and I can't wait to see what happens, by next week when I see him again. So anyway, but I'm teaching them now, feel out from your body basically, and are you pulled up, down, north, south, east, or west, and then follow that. And then they're just like, people either say, I don't notice anything, which I feel like has become rare, because it seems like once we're relaxed and in that state of like emptiness, they can access it so much more easily. But yeah, so I start with that. And that's always a really powerful tool. And then there's a few other things that I'll use, maybe when things are more complicated, or just when it seems like they're called for. But one of the things that I was taught going through this training, which by the way, I felt compelled to say, like you can follow them on Instagram. It's like at Peru Shamans, I think, but it's a group of Caro that are like welcoming to Westerners. They want to like teach this stuff, and that's part of how the guy who made the school in New Mexico got taught. They're like, we think this is for everybody, and we want to teach it, because I don't know how you would go about finding like this knowledge that could be considered sacred and private. I mean, I just don't know how else that would work. So I was happy that happened. You can follow them and see, but they want to teach this stuff to people. One of the ways that they look at it is there is like further out into our space the way it was taught to me is bands of protection. Who knows what the like actual translation is, but like the earth is protecting our root and our sacral center, and the water is protecting our solar plexus, and fire at our heart, and air at our throat, and then light at our 3rd eye. And so we'll go through just this imagery of there's a mountain with a river runs down it, and then it starts to flow up through your body, and then there's this lake, and then there's this fire, and it's like bringing the water and the vapor up, and then once it gets here, it turns into light, and then goes kind of out of your head and around you, And I find that some people have really dramatic change in their awareness just by going through that. But I also feel like it has to be placed appropriately, like when they're in a state to receive that. So I don't know if that makes sense, but I'm trying to take what I learned about something that's kind of abstract and would be hard to ask somebody to believe in and insert it into a treatment where they can be more receptive to that. I don't know, is that making sense?
Yeah, an appalling amount of sense. Like there are all kinds of things like, oh, I didn't know that, but now that you just said that, I'm like, boom, 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 boom. Like
Okay, sure,
these
good.
things make sense now.
Yeah.
But also, do you ever have people who are like, dude, I just have a sore knee. Can you just like?
I mean, rarely anymore, but yeah, I do have. It's usually like men's men, the man's man. You know what I mean?
Yeah.
Like my back
I
hurts.
hate those guys.
It's just it's my back hurts. I don't want to hurt anymore, and so we don't talk about like I don't get into all this stuff. There is one person.
I like to needle those guys.
I mean, we
No,
haven't talked about-
no. I just realized that was
Yeah.
not a pun.
Yeah,
that was
I mean,
intended.
Me too.
Right?
Yeah. Yeah. Put a needle where they hurt.
I like to be a dick to those guys. Is
Yeah,
what I'm
sure,
saying. But you
sure.
also do needling,
Yeah, that's so.
and you do dry needling,
Yeah.
which is somehow different than acupuncture.
It's just the mindset. It's an acupuncture needle and it's a westernized version. So like some acupuncturists would say dry needling is dumbed down acupuncture.
Oh.
Because we're not taught about qi. We're taught about trigger points and using a needle as a way to get like this deep down trigger point or something that you can't get with your hands.
Is it? Do you feel like it's dumbed down? Like, should you be thinking about qi?
I don't know what's right for everyone, but 100% for me, like when I learned it, it was like, this is my next step of doing acupressure. Now I have unlimited fingers because that's one of the barriers is you can only do as much as you can do with your hands.
Sure.
And so now I can do whatever I need to and you can keep them there and then do other stuff. So I'm putting needles in. That's like, only if somebody's like afraid of needles so desperately that they won't let me put one in to just show them that it doesn't actually hurt and starts to feel good. Especially when it's left in for a little bit, or if you barely put it through the skin, and then people just start to be like, oh, that's nice. So I'll put needles in and then do like cranial work, and then I'm also using like sound. There's music that we can use, and for a lot of times, right now I feel like I'm giving away the secrets, but it's like, it just seems like the relaxing music is on. But I don't know if you're familiar, there's this is one of the things that I'll say that I'm like, this is gonna sound stupid, but or sound corny or whatever, or too crunchy
Please talk
or whatever.
about me. Talk about the spirituality of music.
Yeah,
Please,
right.
please.
So there's certain, it was one of those like kismet moments in my career where I was being, my boss was paying for me to go to, it's called therapeutic listening. It's mainly for children who have a hard time either like becoming like up enough to do therapy or are too up and need to like relax to do their therapy. It's just modulated music. But when I was going through that class, I was also having these thoughts about how like sound affects us and was doing a little reading, and I came across like this chakra has this frequency, this chakra has this frequency. And I was like, that could be super easily argued against. I'm gonna have to like, but I liked it. So what I did was search for just those frequencies to listen to. I actually started with just one, and it was on in the background during it was like an online therapeutic listening class. And when I was done, I was like, God, I'm just like jello right now. And I wanted to go to sleep, and all I did was sit here all day. So because of that moment where I was like, man, that really affected me a great deal, I started listening to all the different ones. And I could feel that as I would change the frequency, that I would feel like a little buzz wherever that frequency was, like inside of my body. And that was about all I needed to be like, oh, well, this is valuable and this is coming in to my sessions with me, because I mean, music is an easy thing and we're always receiving. Our ears are always like scanning the environment, so.
I've noticed that, well, one, listening to songs on your phone is the fucking worst. It's fine for like cataloging, I have listened to this song, but I've noticed that when people respond emotionally to a song and it really sticks with them for a long time, more often than not, it's because the low frequency instruments had a more prominent role.
Okay.
So, I'll stop short of saying that is a thing globally. For me,
Yeah.
the songs that stick with me are because the low frequencies, like 200 hertz and below, were right up there, right up there in the mix.
So I don't know that I have much opinion besides I think that that's interesting. And the low frequencies, basically below like 400, are ones that I only have been inserting into a session with tuning forks. And I have a friend right now, this is what I'm thinking is like, I want to know what Matt says, who's a musician and who's currently in the process of making an album for me. Because the way I'll utilize music is I'm like, here's like the dominant like energy center that we need to work on, song for that one, and then we're gonna start doing all the other work. And so he's making me, but it's all kind of like the stuff that's made that way, I don't know, it's kind of not great music. And I really appreciate his music and have, like when I listen to it, I have like experiences and it's moving, and I love what he's channeling through his music. So he's making one that's emphasizing the 100s and the 200s as well as all the ones that I'm used to using. And so I'm gonna be curious because I don't have that experience with the lower ones besides with the tuning forks. But I mean, those are the ones that are more connected to the earth, and who the hell knows? But I think it's interesting.
That's why.
Yeah.
Connected to the earth. What's up?
Clearly you're connected to the earth.
I just played for Rachel just before you got here. I wrote a country waltz that has like Rage Against the Machine drums in it.
Okay.
Yeah, the kick drum it really feels like a underwater heartbeat.
That reminds me of. So I was going through the process of, like, I point to the directions because that's how it's laid out when you learn it, is you start in the south and move your way around. But getting towards the end, I was drawn to like the hand drum. And I use that sometimes. It seems like it's decreasing lately, but there wasn't any training in it. She was just like, you tap into the earth and you play the heartbeat of the earth. So I thought that was pretty like right on point when you're talking about how it's like actually sounding like a heartbeat in your song. Yeah. That was my only instruction, was connect to the earth and play the heartbeat of the earth.
Well, it's not it's not technically true because apparently the heartbeat's in 5/8, but the heartbeat, the human heart beats roughly in a waltz.
Oh, that's interesting.
Yeah, which I kind of knew already, but I also went down a huge waltz rabbit hole. So you're doing physical therapy, but more often than not, you end up addressing sort of metaphysical stuff, and trauma and all of that. How do you, in order to be drawn to that, you have to be an empathic person, I think.
I would think so, yeah.
I'm sorry if you're a sociopath, but so how do you, and I'm asking because I am uniquely ungifted at boundaries, how do you not take all that shit home with you?
I mean...
Or even just from session to session, as one person leaves and the other person comes in, you're like, oh my God.
I think it's a good question because I hear that from people, but I've been invigorated. Like when I had like a year of depression, and my best part of my day was when I was treating people. And then I'd go back and be like, ugh. Like afterward.
Only a year, dude?
Yeah, yeah.
You fucking dabbling?
Well, I'm happy that that's all it was. I do not want more. I mean, there's depression throughout my whole life, but like a year of like where I don't want to do a goddamn thing, you know what I mean? And like just shit, you know? But anyway, that's what I noticed is like, oh, I feel invigorated. Like I want to treat more people. And during that time I had 2 jobs, so I was working like 50 hours a week treating people. And I still feel that way now. I'm like, what a good day, you know, once I'm done. So I don't have a good answer. Maybe I'm lucky that I'm not taking it all on. And if I had to guess, I feel like I'm maybe still learning what the answer to that is. But the way that I'm approaching things is that I'm not like doing anything, and it's not like anything about me. I'm helping people with whatever I can do to help right now, and just letting go of that kind of control, which was tough starting my own practice, because you have to like put in enough effort to like get something back, but also be like free flowing enough to like not like hold on, you know what I mean? So like patients will come and go, but you also need to like not only let them come and go, you know, does that make sense what I'm saying? But what I've come to, the way I've come to feel about like what I'm doing with my practice is that I'm not, I guess I think I just said it this way, but I'm not actually doing anything, and I'm just, my job when I'm at work is to go with the flow and let whatever happen. And I have education, and like I have to have this like foundational knowledge to make it so that I can function within our healthcare system and our culture and our business world and like make money and things like that. But once all of those processes got into place, I'm just like, I can just open up space and work with people and help them the best way that I can. So I'm not feeling like there are things for me to take on, you know. It's just kind of like, here's my snapshot about their life at this moment, and they'll go and they'll come give me another snapshot next week, and the next person will give me their snapshot, and yeah. So I don't know how much sense that makes, but that's kind of the way I feel about it right now.
Do you have any like events or anything coming up that people would need to know about, or more importantly, like website, anything like that, contact info?
Yeah, the website is stepforwardwellness.org. The thing that I'm excited about that isn't coming out anytime soon but I'm doing a study with a professor from Grand Valley to measure what's going on with our brain waves, our electrical heart activity, and electromuscular activity when we do what I've been describing. So I made a protocol for like, here's where we're gonna put the needles, and here's how we're gonna approach the hands-on therapy, and here's how we're going to insert sound into it, and we're just gonna measure all that stuff. And so
that's exciting.
Yeah, so that'll
insert sound into what?
Into just this whole thing. So it's like, the way I look at it is needles go in and it starts to kickstart like our nervous system, like entering this like calm, quiet state. And then we're gonna be measuring, is that happening, you know? And then the hands-on stuff, I feel like kind of fine tunes it a little bit more and like takes our next step there. And then the sound is what I'm really interested in seeing, is how does our body react to these different frequencies as we go?
What if you wired those needles to certain frequencies?
I mean, that's a good question.
And like ran like 200 hertz into...
I don't know. I feel like, here's my experience.
I'm just saying, if you need a third on the study,
I think it's
a pretty dope idea.
I think it's worth thinking about. My experience with how the vibration of sound affects us is it's like we have to clear out the space for it to like come in. And people will do that. They have weighted tuning forks where it keeps going for longer, and then they put it on a person like that, like on acupoint. So that's probably the closest that's happening right now. But also people do, it's more like stick a needle here, and then run electricity through it to make the muscles like spasm and relax. So I think that's probably the closest that people are getting right now. But that would be interesting. We could do it for science.
Yeah.
So I'm just doing it with tuning forks, and we're just gonna go through and let a tuning fork let the sound die and do the next one.
I'd be willing to be a guinea pig, because it seems like that also could be cool to be a generative art form. Like if you wired me up
and then just ran through
various frequencies, and then whatever my body did generated it through like AI or whatever.
Okay. Yeah, I don't even know, but
I'm just... Yeah.
Just spitballing. Yeah, okay.
Yeah. Or just tase me, bro.
I'd be interested to see that work.
Yeah.
Or as like a live piece, right?
Yeah.
Yeah, if you guys set that up, I would come to that for sure.
Yeah, my level of expertise is grabbing or peeing on an electric fence. So that's all I know. I just went like this and I don't even have a hat on. But thank you so much. Tell me the website again.
It's stepforwardwellness.org.
Great. Go there Definitely book an appointment. Get hooked up with. Yeah. Yeah. Thank you so much.
Yeah,
This
no
was
problem.
great.
Yeah.